Thank you, Sue.
And
thank you so much for inviting me. And
pleasure.
I think I want to just sort of really be very clear about where we are in this sort of discussion, because obviously the requirement to have a vaccine to be employed as a midwife is an employment issue. But inevitably, if midwives have to change roles, or they are students, for example, joining the register, that is where we actually sort of come into this space. So the sort of things that I'm thinking of is that if a midwife chooses to not get the vaccine, and then the midwife moves roles, through deployment, then there could be an implication for maybe not the initial revalidation, but definitely for the subsequent revalidation, about being able to maintain their registration with us. Now, obviously, as you and I know, Sue, we both do very different roles, other than clinical roles, so that it would depend what they're doing. But I think that is something to be considering. Now, students, of course, it's the universities that tell us that they have met all the requirements to join the register, having completed the programme. And if after April a student continues on their programme and they've chosen not to be vaccinated, then that's inevitably going to affect their ability to complete the programme with a sufficient number of hours. So it is a sort of a matter for us, but you can see it's more of a registration type issue in the event that practice hours are not being met or programs are not being met.
So technically you could have a student midwife who could therefore do her program but not actually complete because she hasn't been able to fulfill the clinical component of her placement.
Yes, because obviously they will be required to have the vaccine in order to be able to enter into practice. Now, of course, we're talking about England at the moment, and we are an all-4 country regulator, but it is actually ensuring that they have the ability to meet the requirements of the programme to be able to then register with us. And of course, going forward, if you've got, say, some students who maybe are qualifying this spring, then they may be registered with us, but then within England not being able to practice. So it's sort of those sort of issues that people have to sort of consider when they're thinking about our role in this space. The code makes it very, maybe have some really helpful steer for people as they make some of their decisions. For example, about the code would say that registrants have a duty to act in a way that puts the interest of those using health and care services first and prioritises their care and safety. And of course, whilst we recognise that everybody has views, their own personal views, there will still be midwives who will need to consider the evidence base that they provide to women to help them to make their decisions. So the code, can be very helpful in this space, particularly when it's talk about the importance of use of evidence and what it actually means to the individuals. And of course, we all have a duty to remain good health and ensure the health of our colleagues, not only the women and the babies.
Because I noticed on the NMC sort of question and answer system that, there's a lot of information on the situation regarding COVID, and I'm not sure how many people have visited the NMC website. If for those of you listening, watching, if you haven't, it's a very useful site to look at because it's very clear. It's not emotional. It's not. There's not. We've had the evidence from Helen, but there's not a huge amount of hard evidence. It's more about following the code and your registration requirements. So it's sort of a different I think it's a different focus, which people might find useful if they haven't gone by there recently.
Yes, and I've given, hopefully people who on the webinar today will actually receive that link, that there is a whole link about information about vaccines, talking about with useful links to the human medicines legislation, the MRHA website, as well as the importance of acting in line with the code if you're administering vaccinations, and also information about exercising your personal views appropriately. So hopefully people will find that sort of helpful. And then of course we've got a whole COVID hub, which talks as well about students and obviously care given by midwives, nurses and our nursing associates, you know, during the pandemic. So hopefully people will have a look at that, because it is some helpful information there.
Yeah, I mean, I'm interested in aspects of this. Like, I was listening to a midwife talking on the radio the other day about her, you know, choosing not to have the vaccine, and I was sort of thinking, well, how does that feel when you're looking after women, and how are the women going to feel about a workforce who may not have the vaccine? I don't know if that's come through at the NMC from any users, because I know you do involve users a lot in your work, don't you?
It hasn't specifically, but obviously the discussions have been about the importance of midwives giving the evidence. Women will need to receive that evidence to make their decisions. And sometimes, and this could be in all aspects of care, and sometimes those decisions might be not what we would advise or what we might recommend, or even might incur more risk. But the midwife's role is to provide all that information they need based on good quality evidence, so they can make that decision. So that's why we talk around about upholding the code, and if you've got very strong personal views, what that actually means when you're perhaps engaging with women and having to give that advice.
And I suppose also for people who, I mean, I think it's easy to forget how difficult this last couple of years has been for practitioners. People have been so busy, and now I know from what people have said, very tired.
Yeah.
And they might have not even had time to think about, well, should I have a vaccine or shouldn't I have a vaccine? And some might have said, well, I'm not going to have it. No way, no how. And then maybe changing their mind, but kind of having got into a position of having told everybody you're not going to do something, and then maybe you change your mind. You know, where does that fit as individuals? Because we can all change our minds. Our lives change. Maybe we want to go abroad, and that's one of the requirements. Thinking of some famous incidents recently that may have changed your viewpoint on certain things. I don't know, but I don't know whether it's useful for people to think about whether you've got yourself painted in a corner, as it were. I don't know if that's an issue for some midwives or not. And I noticed not many people have come up with any questions yet.
But it's also about getting that support, isn't it? You know, because this is an employment issue, is actually but using all those support mechanisms which are being set up to support that decision making. We wouldn't be asking for that status as because that's not our role to do so. But it's actually ensuring, and you know, we do hear that there is a lot of support out there, whether it be through the unions or professional bodies or indeed their own employers, so that people can talk that through. And that's why hopefully that our information will be helpful to start some of those conversations.
Because there have been a number of events going on for people to discuss different aspects. So perhaps if anyone's listening and in that category, maybe they need to think about going and attending other venues just to get a whole rounded picture of the situation.
And a bit like what we'd expect for women, isn't it? That they have all the information that they require based on high quality evidence, so that they can make those decisions.
Yeah, absolutely. Because I had I had a question about whether it's the same situation for a student midwife, which you've actually answered brilliantly, Jacqui, because you've talked about being able to achieve the placement requirements.
Yes, and the reason I brought up the revalidation is that depending where you are in that revalidation cycle, the first revalidation might not be problematic, but we do frequently get queries about from midwives who've working in a whole variety of roles and have almost taken that step beyond midwifery practice. So it would be quite hard to account for those hours in that revalidation process. Now, many roles that, that are not necessarily clinically focused are very clear. So I think when people were thinking about redeployment, if that is what is actually happening, then that is where obviously registration issues need to be thought about as to whether that is a role that will support them within their revalidation and their practice hours requirements, so they can continue on the register.
And I guess it also because there's going to be limited deployment opportunities, I guess.
So, yeah, I mean, that's what we haven't got really a lot of details about that, but yes, if it was large, you can imagine that would be the case. So that those deployment would is it actually a registrant role, and how would that reflect in terms of what they need to be achieving for their revalidation? So it's just really just something to think about. And obviously do contact us if you needed further advice in that regard. But of course, when you base your revalidation, you base it on the code, but importantly the new standards of proficiency, so that should be also sort of helpful to sort of reflect the sort of roles that people might be doing.
I've just been looking for my copy which I have in front of me. At the moment I have in front of me a lot, as does the code. It is a very useful a check through about what you should be doing and where you're at with this, really. So I mean, is there anything else you'd want to focus on, Jacqui?
Well, I was just thinking, of course, we're talking about England at the moment, and we're an all four country regulator. So,
that's true.
Particularly thinking for people who, may have a ability to move and, work elsewhere. But of course, in terms of our role, the same thing applies wherever you're working in terms of the requirements to remain on the register. That is quite clear.
But technically, if you went to one of the different countries that didn't have that mandatory requirement, and you could practice as a midwife, then you can achieve your regulation requirements. Yeah. Which is an interesting thought. Yeah. A very interesting thought. Okay.
Yeah.
Okay. I've got a question here.
Okay.
Belinda Ackerman. Hi, Belinda.
Hi, Belinda.
Who says, is the requirement for COVID vaccination only for NHS work? If a student qualifies without a vaccine, without a vaccine, can she practice privately? Got it. Sorry, another question came up at the same time. So is it just for NHS work, the COVID?
And of course, social care. Of course, the social care sector brought that in much sooner. Yes.
Yeah, so it is. Okay.
But I mean, obviously that, the code is very critical here in terms of health and your own health, and, all of those sort of elements of the code that would need to be considered. And of course, in private practice, of course, some private practices within a sort of more of an employment environment, so they may have their own requirements. And indeed, the women might have their own requirements for independent midwives. So, I mean, the picture is likely to be mixed, but the individual would have to seek out information depending on where they're working.
Okay, that's really good. Thank you.
As I say, I mean, again, it's not something that we would have a position on, because this absolutely is an employment issue.
Okay, that's very clear. We've got a little flurry now. Thank you, right. People. We've got Jamie Kitching, who's saying, please can I clarify, did Jacqui Williams just say practitioners cannot remain on the NMC register without having COVID vaccine when it comes to revalidation? I think it was more textured than that. Jacqui, do you want to clarify?
Yes, Jamie, thank you for the question, because it's really worth that we're clear. We do not have, this is an employment issue as to whether you have a COVID vaccine. But what I'm saying is that if you were redeployed in roles that potentially was sort of moving away from midwifery practice and scope of practice, then there is the potential that you would have difficulties revalidating in the future, because you would have insufficient hours and insufficient information to revalidate.
So that would be as if you had moved to an office job.
Yes.
That wasn't that your requirement as a midwife wasn't needed, as it were, your skills.
Yes.
And I guess you'd feel that as if you were in that sort of role, and it may be a temporary thing for a couple of months, but if it was long term, you would lose out on all the hours of practice you have to prove you're doing.
Yes.
Yes, that's very clear. I want to do a little advert again for the NMC website on the NMC revalidation site.
Yeah.
Very useful if people haven't looked at it for a while.
And you know, Sue, I would say that for anybody who is looking at different roles, you know, we've often had queries from school nurses and people doing a variety of roles where sometimes the requirement for that role is NMC registration. But then when it comes to revalidating, because they're basing their revalidation obviously on the code and the hours for midwifery practice, that's where some difficulties can arise with some of the roles. So you need to be very clear when you're undertaking roles that are sort of less defined in terms of the scope of practice. And of course, educators revalidate, midwifery educators, and of course, researchers and people in policy, as well as you don't always have to be clinically facing. But it's just thinking about the further you move away from midwifery practice and that scope in all of its forms is, will you be able to revalidate? And that's, I suppose, that's the risk, isn't it?
Yeah,
really?
Absolutely. That's the challenge.
Yeah.
Okay, thank you for that. And Jamie's got another question.
Great, Jamie.
As an RCM union rep, mandatory vaccines does not sit comfortably with many of my colleagues as a human right to choose process. This is something we need to ensure midwives are aware of. I think that's a comment rather than a question. Okay. And then we have Holly Berry. Hi, Holly.
Hello,
says,
Holly.
Legally, can NHS staff lose their jobs in April? I would have thought this would break the Equality Act 2010. I think you might have to check with your union rep, actually.
Yeah.
Check with for that level.
Yeah, and certainly the Royal College of Midwives and the Royal College of Nursing will be very active, I'm sure, within this space.
Yeah.
If you are a member, or even as any other union, do contact them.
Yeah, I think so. That would be good. Thank you. And then we've got a question from Anna T.
Hi, Anna.
Are we saying a mixed message to pregnant people by saying that midwives do not have to be vaccinated until 15 weeks post-birth? I think that's I'm a bit confused, Anna. I might need to read. Are we sending a mixed message to pregnant people by saying that midwives do not have to be vaccinated until 15 weeks post-birth? Send another message, Anna, because I'm not sure that's quite right, but never mind. And I've got Claire McAvan.
Hello, Claire.
As a practice educator for midwives, I'm really interested on the support it can provide to students, especially with the registration of newly qualified midwives. Is there anything specifically aimed at students? I assume that's for the COVID information.
I mean, all students, even when they're on their programs, live by the code. So anything that we put up on our website is equally applicable to students as they move towards meeting their proficiencies, adopting professional values, etc. So although we obviously are talking specifically about about people on our register across the 3 professions, yeah, lots of good messaging for students, which should be sort of helpful.
Absolutely. Fabulous. Now we've got a little more question, because I know that Jacqueline Dunkley-Bent's trying to join us, but having a few technical problems. So we can take a few more questions.
On, yes.
Yay! So we've got Hajera.
Hi, Hajera.
She's interested in knowing the numbers, as it worries me for low staffing levels. I think that's how many people might not be able to stay in role. We don't know really at this point, because this hasn't come in, and it won't come in until April. So I'll move along. Dwi Tambubolon, I hope I pronounced that correctly. Dwi, anyway.
Hi, Dwi.
I graduated in midwifery in another country until I'm currently pursuing my master's degree in UK, but it's not in midwifery. Is there any possibility for me to look for any work experience internship in midwifery in here? My goodness. Dwi, that's a good question.
So Dwi, just so you know, in order to for international midwives to practice as midwife in UK, you would have to be registered with us, and we have a test of competence which midwives sit. It's both a sort of an online test as well as a face-to-face OSCE, and we assess the application to ensure that your suitability for undertaking that test. So absolutely lots of work to try and support midwives who have midwifery qualifications registered in their own country to come and work in the UK. So again, if you have a look on our website, there is a section all about joining our register, with a section all about international midwives, and we would love to hear from you and take you through that process.
No, that's fantastic. Jacqui is the perfect person. She just knows just about everything there is to know.
We don't, just so Dwi knows, we don't have internships per se. We don't have that system. We do in Ireland, in the island of Ireland, they do that as part of their program, but that's not part of the UK way. So it would be you joining as a qualified midwife, or indeed, of course, at the moment we've reopened our temporary register, so that might be something else you might like to look at. Whereas you could be working under supervision of somebody on the full register with the view to joining the register. I'm very happy to have the conversation with Dwi afterwards, if you wanted to let her have my email address, or check out the website, because there's lots of information about both routes.
Fantastic. That's fantastic. You get lots of information, Dwi. Thank you for the question. That's great. Ava says, is it still a possibility this new law will be cancelled? Well, we don't know really, because that just depends on a lot of things, doesn't it? It depends on how the infection rates go and how the immunization goes, a lot of things. So it's you have to sort of take it as it's coming at the moment, really. I would say.
Possibly a question for Jacqui.
Yes, who's still trying to get through, and clarification from Anna T. Thank you, Anna, for keeping with us. She's talking about midwives who then have their own babies 15 weeks post their own births. I think that goes to what the question. Oh, it's a mixed message. Pregnant people are saying midwives do not have to be vaccinated until 15 weeks. I guess if you're being treated as a pregnant woman, that's kind of different to being treated as a midwife, if that makes sense.
Yeah,
but you're encouraged in both situations to have the vaccine, aren't you?
I would say seek the advice through their employer and heads of midwifery, as well as human resources.
Locally. Yeah, that's a good point. And then Bev, hi Bev, says, please, if you're registered midwife from, hang on. So what is the plan for practitioners who are exempt from the vaccine, and also students in training currently?
Well, I can ask the latter thing, is that the students in training will need to be vaccinated in order to meet the requirement from April. So we've been very clear on that. But the exemption, of course, is again very much sort of not within our scope of comment. And I think, again, there will be obviously information about exemptions, but students will obviously have to meet those requirements to remain on their programmes.
Yeah.
Well, not so much remain on their programmes, but being able to go into practice. To complete. Yeah.
And we have had several, we're having several questions. Got a question from Juliet Adoma, who's registered in Ghana. Do you need an IELTS before you can register with the NMC?
Yeah, yes, you do. So that is one of the requirements. So just check on the requirements. There's a tab as you land on the page. There's a number of tabs, and the far right one is about joining the register. And if you click down, it will take you through all the requirements for an international midwife to begin to start the assessment process. And one of those is that they do have to have got that IELTS. But there obviously is provision for people who have studied or studied in their own country, but all that information is there on that website about that.
Okay.
So can I just return to the students just for a moment?
Yeah.
If any students on the call have got concerns about this, particularly if they're thinking what this might mean for their programs, do get in contact with their lead midwife for education and their program directors, as well as their personal tutors. Do have those conversations now, so it's very, very clear what all of this means for you, for students on the program.
Fantastic. That's fantastic. Thank you very much. I think we've got most of the questions taken care of now.